Okay, hello guys, welcome to All Round Health Talk. It's been a very long time, but we're back again, and today we want to do something different. So, we all know that it's the month of October, and October is the month for breast cancer awareness, right? So, this time around, we don't want to just focus on the women, we also want to focus on the men. We want to talk to our fathers, our brothers, our boyfriends, our husbands, all the men in our lives. We want to reach out to them today because studies have shown that the first cause of cancer in men is the prostate gland cancer. Right? 1 out of 7 men develop prostate gland cancer in their lifetime, and 1 out of 39 men who have prostate gland cancer die. So today we want to focus on the prostate gland, how it functions, how to take care of it, and the screening exams that would help the men in our lives take care of their prostate gland. So here we have an image of your prostate gland. Now, this is what your prostate gland looks like. It's, like I said, the size of an apricot. Now, directly above your prostate gland is the bladder where your urine comes from, right? This here is the urethra, which actually begins from the prostate gland because the bladder has an opening that connects to the urethra. It passes through the prostate gland, continues here and goes through the penis, and yes, down here you have the opening of the penis, right? Good. So here we have the testicles where your semen is produced, right? The semen contains the sperm cells which are in charge of fertilizing your eggs, which are in charge of fertilizing the eggs of a woman. Great. So what happens is this. Here we have the seminal vesicle. Here we have the ejaculatory duct. Good. So what happens basically in a man? In a man, here where we have the testicles, the semen is produced, right? Now when you ejaculate, the semen goes through this tube, the vas deferens, and goes through the ejaculatory duct and comes here where it connects with the seminal vesicle. Now the seminal vesicle produces a fluid that adds fluid or liquid to your semen. Now that goes into your prostate gland, right? What happens when you ejaculate? When you ejaculate, your prostate gland contracts. When it contracts, it closes the opening of the bladder, which means urine cannot pass through the bladder to the urethra at the time of ejaculation. At the time that it contracts during your ejaculation, it also produces its own fluid. Now, the fluid is basically to protect your semen and to make your semen much more mobile. Right. Now, in the fluid that this prostate gland produces is an enzyme which is called the PSA, which is basically known as the prostate specific antigen. Now, the function of the PSA is to protect your semen and give your sperm cells a high success in terms of fertilization of an egg. Great. So that when you ejaculate, the prostate gland contracts, secretes its fluid, which enters into the urethra to combine with the semen and the seminal fluid that comes from here. Now that passes through the urethra, continues down here, passes through the penis. So when you ejaculate, then you ejaculate the liquid. Now the liquid contains your semen, seminal fluid, and the prostate fluid. Good. At the time that this prostate gland contracts, there is no entry of urine because remember that the opening of the bladder is shut, and that is why a man cannot urinate and ejaculate at the same time. One has to happen, one of both of them. So you can't have both processes occurring at the same time. So basically that is what your prostate does. It protects your semen, makes it much more mobile, and produces a PSA that will protect your sperm and give it a high quality and a high success in terms of fertilization of an egg. So basically this is what happens in a man's reproductive system. And so whatever happens to this prostate gland does not just affect your reproductive system, it also affects your urine system, since urine comes here and passes through the urethra, which is found in the prostate gland. So if this prostate gland has a cancer, if it's swollen, if it has an abnormality, it will compress your urethra and you'll find it difficult urinating. So now we're back to why we need to focus on this prostate gland, because of the function it has in the man's life. Now, knowing what the prostate gland looks like and knowing how it functions, what do we need to do for the men in our lives? We need to educate them on the importance of taking care of the prostate gland. Now, the prostate gland is very important, as we've seen, in terms of your reproductive system, and also in terms of your urinary system. So there are so many things that could affect your prostate. There are so many diseases that could affect your prostate. Amongst them, we have the prostate cancer, which is the most malignant in terms of other diseases that can affect your prostate gland. We also have the enlarged prostate, which basically is evident in half of every man from the age of 50 to 60, and by the time you get to 80 as a man, basically almost every man at the age of 80 has an enlarged prostate gland. And then we also have the prostatitis, which is a swelling of your prostate gland. Now, what do you have to do to take care of your prostate gland? Now, from the age of 25 as a man, your prostate gland gradually begins to increase. Now, studies have shown that at this age, the prostate gland begins to increase, but the reasons are not known. So by the time you get to 40, your risk of having an enlarged prostate or prostatitis or prostate cancer begins to increase, and that is why it is recommended that a screening must be done on a yearly basis from the age of 40. Now, every man from the age of 40 needs to pay attention to his prostate gland. Basically, we tell women that women have to do a breast self-examination every day, especially when they are taking a shower. But the men do not have to go through that process every day. All they have to do is go for a yearly checkup of their prostate gland. How do you do this prostate gland checkup? It's basically done by a rectal examination. It's a digital rectal exam, which basically can be done in the consultation office of your doctor. Right. So basically, the men have to lie in a fetal position, and then the doctor, obviously with a glove and a lubricant in the finger, will have to introduce his finger through the anus of a man to examine the prostate gland. Now, this examination will help the doctor palpate your prostate gland and help him figure out if there are nodules, if it's swollen, if there is any kind of abnormality. And based on that rectal examination, you will have to do other tests, which is the next step would be a PSA, which is the prostate specific antigen, which we've mentioned that is one of the enzymes that is secreted by the prostate gland to give your sperm cells higher success in terms of fertilization of an egg. So you would have to do a test for that to know the level of PSA you have in your system. Now, if it's high, then your chances of having an enlarged prostate or a prostate gland cancer is very high, which means that your doctor would have to do a biopsy of your prostate gland, which will mean introducing through the anus a needle to your prostate gland to take a piece of your tissue to study the prostate gland. You can also do an ultrasound while inserting the needle. So basically, for you to take care of your prostate as a man, you need to eat healthy, you need to do exercise, you need to cut the carbs, you need to reduce alcohol intake, smoking. Basically, these are things that help you generally in terms of your well-being. But it is very important to do the rectal examination every year from the age of 40. to reduce your chances of having any disease. And even if you have one, it could be caught early by doing your annual rectal exams, and that could help your prognosis. Now, I get that the idea of a doctor inserting his finger into the anus of the man sounds horrific, but it's way better than what could happen if you do not do your rectal examinations. So this month, basically, we just want to encourage men to take that step and see their doctors and get themselves checked out, so that we don't lose the men in our lives. Just as we care about the females, we also care about the males. And so we're using this month to reach out to the men. It is very, very important for you to do your rectal examination every year from the age of 40. Okay, so we hope that you've learned a lot from this video. Please don't forget to share the video, like the video, leave a comment. If you have any doubts, any questions, just leave your questions down there and we'll answer your questions. Thank you, and we hope to see you next week. Bye.